Hello everybody, it's Stevie here. I'm just looking to introduce my book, which is Borderline Personality, the Ultimate Self-Help Guide. And this book is being put together over some consistent and serious research from peer-reviewed articles and researchers around the world. And borderline personality is a recognised mental illness that can come upon people, and there's millions of people worldwide being exposed to this problem. However, part of my research gave me some insight to some of the strategies that you can use to gain an increased awareness of the symptoms, but also learn how to cope with those symptoms. Now, this particular book, I'll just refer to some of the contents so that you've got a feeling for what's involved. And personally, I think if you are suffering from borderline personality disorder, this book could change your life. Alternatively, if you're a family member or you're a parent or a spouse of someone who has this particular disorder, it'd be wise to also consider some of the information I'm going to present in this video. So basically, if you want to find relief from the psychic or emotional pain and find some peace of mind, then you'd be wise to listen in. So what is borderline personality? It's often referred to as BPD, and it's a mental illness that's been recognized with the American Psychological Association. It's also part of the main manual, which is the DSM-5, which is an assessment manual to allow psychiatrists and psychologists to assess the seriousness of a particular illness and where it fits in the assessment program. Now, I was mentioned just briefly that if this particular disorder affects millions of people worldwide, and it's estimated that 1 to 2% of the population versus each country have people who are afflicted with this disorder. Now, I considered lots of the global research. I looked into the high-end experts such as Dr. John Gunderson, who's known as the father of BPD, Dr. Marshall Lynham, who was also very instrumental in putting the first educational course together based on her findings and her experience, having suffered the disease for many years also. Now, I've also taken a look at what the new insight is providing from these research studies, because in the past it's been seen as that once a person has this problem, it's very difficult for them to get relief from it or even find a cure long term. Now, it's these debilitating symptoms that can cause serious problems, and a person who's not even being diagnosed with the problem to someone who's suffering a chronic disorder, a long-term exposure to the illness, can be exposed to mood changes, mood swings, but also the fact that it could also be in a situation where they're exposed to certain triggers, life triggers, that can lead to high-risk health problems. And those two concerns basically revolve around self-harm or even escalating to suicide. So you can see the seriousness of the issue. And that's why I looked at the research, because I felt as though maybe in modern day science and neurotechnological inventions such as the fMRI scanning of the brain, we can see more of what's going on in the brain and the reasons why these symptoms are occurring. Now, what caused me to also move forward with this research was that I had a spiritual visitation, and there was a calling in the middle of the night for, a voice appeared and it just gave a brief statement that led me on to this research and to follow it through. So what's the book basically about? And I think it's important, if you are suffering from this problem, or you know somebody is, that you can become very aware of what you can do. So I've basically sectioned the book off into 5 major key areas, and the first area is basically looking at the understanding of the symptoms of borderline personality disorder. Also looking at the causes, because I think you'll be quite surprised that some of the causes are not what always seems to be the case portrayed in the media. And some of the common issues and the risks involved, because you need to know what are the triggers and you need to know what are the risks to the person's health status. Now, I also want to bring forward some of the content from the chapter which I focused on the issue of dealing with stigma. And people who have a mental health illness often are exposed to the stigma, discrimination issues, to the point of even labelling on a daily basis, and that can seriously harm a person's self-esteem, self-confidence, and I thought it was very useful to at least include some of the issues that people have to deal with, and you'll be quite surprised that some of the high-end professors around the world have put their experience together and provided some research papers on the reasons why stigma, the reasons why discrimination, and the reasons why labelling occurs. And it's often the case that people don't do nothing about it, so people go along their daily chores thinking it's a normal reaction, but it basically isn't. But on the second part of the book, I want to give you some insight to some of the strategies, mostly alternative lifestyle strategies that people can use, because basically lots of the control measures for this disorder are revolving around medication. There's quite a lot of complex issues that go with that, besides the fact that people can have side effects or even change for the worse. It's more beneficial for me as a self-help author to give the information about what's alternative in regards to medicine, and lifestyle choices, and even dietary intake can be one of the major solutions that people can take on board. So I want to give a good solid understanding of the stress prevention strategies that you can use, because stress is quite a big serious trigger when people are exposed to symptoms of borderline personality. So the less that people become stressed, the more opportunity is that they can improve the quality of their life. And it also goes into interpersonal relations. So I also want to look at the psychotherapies, because also the experts in borderline personality give their opinions, their experiences. Some of the researchers I came across, such as Dr. John Gunderson, Marshall Lynham, and even Dr. Daniel Amen, who's conducted over 90,000 brain scans in his Amen clinics in the USA to see what's going on in people's brains and how these triggers can be diffused, but also what happens when a person is exposed to stress or different influences. So I want to present new alternative treatment strategies that have been known to work. Many of the studies I came across said that people with borderline personality can be experiencing symptoms through the early stages of their life, but as their age increases, the symptoms often diminish. But also the opportunity to try new things and to use their skills, because often the borderline personality person will have quite, maybe people call it eccentricity, but they do have a lot of high-end skills in certain areas as well. So the strategies that I'm presenting will also give the opportunity for the borderline person to pursue those new activities and to change the neuroplasticity in their brain. I also speak about embracing spirituality, because some of the research I've come across have done some studies on this, long-term studies, and seen that changes in people's behaviours, their attitude, their brain can be enhanced if they take up the opportunity to learn about and practice spirituality. Often some of the high-end experts even say there have been remarkable recoveries from the illness when people adapt these types of strategies, and they use it as a bit of a healing mechanism. So things like prayer, things like meditation, things like mindfulness to get the person away from their everyday worries into trying new things and trying new hobbies, and keeping faith and keeping hope, because often the borderline will tend to lose hope or lose faith in the system that they're under. And this book hopefully will give you them strategies you can use to get you back on track again and to enhance the self-healing mechanism. So there you go, that's Borderline Personality, the ultimate self-help guide. And I hope if you are a sufferer, or you are someone that's close to someone who is, that you can take on board these main points in this book, because I think it will give you some insight to why a lot of these symptoms occur, what's causing them, but more so importantly what you can do about them without having to rely on heavy dose medication. And the psychotherapy treatments that have been proven have been mentioned quite consistently, and that, along with some self-help strategies, can also make you improve the quality of life and make you a more happier and more content person. On that note, thank you very much for tuning into my video, and hopefully you can visit my website if you want a copy of the book, which is in hard copy, as you can see, or you can also order the ebook and the audio as well. Even if you don't get something from it, you don't have to read the whole book. Pass it on to someone that might need it. Okay, thank you.